of Neisseria meningitidis, which is a very problematic bacteria. So, to understand why, let's get started. And we're going to be using a sketchy image titled "A Shocking Death on Campus," which is the image over here for your reference to better understand the important principles associated with the Neisseria meningitidis. Alright, so here are some general features about this bacteria. First of all, it is gram-negative. It also has kidney bean-shaped diplococci formation as implied or represented in this stained image. And then it is also oxidase positive, and it's going to grow on the chocolate agar. And so what's going to happen is it will also ferment maltose. And that's what makes this different from the Neisseria gonorrhoeae, because Neisseria gonorrhoeae does not ferment maltose. Anyways, to remember that the Neisseria meningitidis ferments maltose, think about the investigator investigating the malt liquor. So here's the investigator investigating the malt liquor to see if that could be behind this person's death. The bacteria also has large polysaccharide capsule, so think about the glass cases on the floor. And yes, so these are glass cases. I have no idea where they are. But anyways, let's just keep moving. At the very least, think about the fact that it has a large polysaccharide capsule. And most importantly, a latex particle agglutination can be utilized to identify capsular antigens of this bacteria in cerebrospinal fluid. Whenever we suspect some meningitis being involved behind a patient's symptoms. So for reservoir, it is typically found in the human nasopharynx, where 5 to 10% of humans in general can be carriers of this bacteria. And then for transmission, it is going to occur through the respiratory droplets. It can also colonize in the oral pharynx. And to remember this, think about the investigator analyzing the bottle with the nasopharynx swab. So it's investigating the bottle with the nasopharynx swab. And I guess to remember that it colonizes in the oral pharynx. You can just imagine if the investigator was using the oral pharynx swab instead. But at least the nasopharynx swab helps you to remember that the main reservoir for the Neisseria meningitidis is in the human nasopharynx. In any event, after this colonization, it's going to spread to the meninges via the bloodstream. And disease occurs in only about a small percentage of colonized individuals, or individuals with these colonized Neisseria meningitidis. And then infections will typically be common in dormitory settings or small closed areas, and that is why this sketchy image shows a college dorm room shown over here. So if you're a college student or a graduate student, or if you're a student who lives in a dormitory, be careful about this bacteria. Anyways, let's talk about the pathogenesis and important virulence factors. For starters, we have the immunoglobulin A protease that allows for the oropharynx colonization. And we're going to have the pili and the outer membrane proteins that will facilitate the bacteria's ability exposes an individual to bacteremia due to the obstruction or inhibition of the membrane attack complex formation. And this information is also provided in the overview of the Neisseria that I covered in my previous video. So feel free to go check that out. Anyways, the polysaccharide capsule is antiphagocytic and antigenic. And remember that the Neisseria meningitidis has a large polysaccharide capsule. So, given that they are antiphagocytic and antigenic, this makes this bacteria quite infectious and problematic. And specifically, there are 5 common serogroups of this polysaccharide capsule. They include the serogroup A, serogroup B, serogroup C, serogroup W135, and serogroup Y. Now, the serogroup B is not strongly immunogenic. It's also known as sialic acid. And then the B strain happens to be the most common strain in the United States. So, this can be problematic as immunogenicity is important for drawing and enabling appropriate immune response. But anyways, the capsule is going to be used for serogrouping, detection in the cerebrospinal fluid, and also for vaccination. And that's what makes the polysaccharide capsule for the Neisseria meningitidis significant, especially in a clinical setting. So to remember these different serogroups and their properties, think about the glass case around the syringes representing the vaccines for A serogroup, C serogroup, and D serogroup, but no syringes for the case B. And these are the cases that are supposed to wrap around or cover the syringes. So A, C, D cover the syringes, but serogroup B, there's no vaccines for it available. And then for the endotoxin, it is a lipooligosaccharide. So the overproduction of the outer membrane envelope will cause an inflammatory response through this endotoxin. And you can remember this by thinking about the envelopes on the floor on fire, as shown over here. And the envelopes signify the outer membrane envelope that causes an inflammatory response. This is then going to lead to the leaky capillary formation, and that ultimately leads to fever and a septic shock in cases of meningo. cefotaxime. I always struggle to pronounce this medication. Cefotaxime, okay. Ceftriaxone, yep. And if for neonates and infants, you can use either ampicillin or use ampicillin cefotaxime. Lastly, for prevention, know that the vaccine is a capsular polysaccharide containing the strains Y, W135, C, and A, which correspond to the serogroups that we talked about earlier. Now, the reason why the B strain is not included is because the type B capsule is not a good immunogen, and unfortunately, it's a type B serogroup that is found in 50% of cases involving Neisseria meningitidis in the United States. And then also, for prophylaxis, it can be given for anyone who is going to be in close contact situations. And these will involve utilizing the rifampin or the ciprofloxacin medications. Note that the ciprofloxacin is a fluoroquinolone. Interestingly, this prophylaxis measure is now given to all children. Along with the vaccines. And so, to remember the rifampin, think about the friends of the victim barred from entering the room by the police carrying a rifle or riffle. And that rifle is supposed to